It is one of the most common surgeries performed in the U.S., total hip replacements, but even more rare for someone to undergo the procedure like Wave 3 News reporter Ken Baker did.
He takes us into the operating room to show us just how far this procedure has come.
What you're looking at is not for the faint of heart. Hammers and power tools, all things you would expect to see at a car shop, but totally necessary to repair my hip.
You may smell, that's got a barbecue, yeah,
I smelled odd things, heard loud banging, and at times was shaken about, but I found comfort in my surgeon, Dr. Jonathan Urasimides of Louisville Hip and Knee Institute. Just like me, he's a lover of country music. In fact, for those who choose to be put to sleep, I can tell you they're missing a pretty good concert. In between songs, he would often show me some of my replacement parts, explain next steps, and then we were back to jamming. Wait, by this time you probably have a lot of questions. Why am I so aware of everything going on? Well, I decided to do the entire thing with no sedation. It was done with just a regional block injected into my spine.
I'm getting ready to give him a mama hug.
This is my mom.
Let him know everything's gonna be all right. Even though he's all psyched up and ready to go, you know there's a twinkling of a little nervousness in him.
Why does her 32-year-old son need a hip replacement? Well, this all came following a hit and run, which led to the discovery of an undiagnosed medical condition. And that's what landed me here, in the care of Dr. Y and his team at Landmark Surgical Suites, an outpatient facility. You know, you can't really hide anything from your mom. Not only was I nervous because of the major surgery I was about to undergo. I will see you like in, 2 hours?
Probably about 2 hours.
I also wondered if I made the best decision for myself by deciding to remain awake. To hear, to be a part, if I want to ask questions, I ask questions. I mean, after all, it's a foreign objects going into my body for the betterment of my body, but also I want to just be awake to experience that. All right, I'm gonna put all this stuff in there. So I do want to be completely clear about something. I believe in anesthesia and its efficacy and its safety, but in the weeks leading up to this moment, I found myself more apprehensive over being put to sleep than the actual hip replacement. And after some research, I found that it's becoming more common for people to be alert for medical procedures. I'm a little nervous now that, you know, got the hospital gown on. It's getting real. It's always been real, but it's a little bit more real, but I'm still good.
They said you didn't want much, if any, sedation, which is fine by me.
In 2006, Dr. Y was the first surgeon to perform an anterior hip replacement in Louisville. Now he's grown to be one of the foremost authorities on the operation.
With an anterior approach, you know, you can expect your leg lengths are going to be, you know, spot on. You can expect not to have to worry about bending over or crossing your legs and popping it out of socket.
According to the Louisville Hip and Knee Institute, Dr. Y performs more anterior hip replacements yearly than any other surgeon in the United States. Through the clipping and hammering and sometimes pulling, I felt no pain. And as weird as it might sound, I actually enjoyed being awake and learning through the process.
I've had folks awake before, but I've never had a conversation with somebody during a total hip, and I've done a lot of total hips, so this is a new experience for me. But it worked out great.
I think when it's all said and done, what made the experience so tolerable was a shared love of country music.
Everything went smooth as can be, no issues, no troubles, went just like it should, went just like I hoped it would with an awake patient. So
well, your singing was great too. It kept me peaceful.
Outstanding.
Yeah. Singing so good, I danced into the waiting room to meet my family on the way out.
Tomorrow morning is when
So that all happened about 5 weeks ago. In the portions of the story where you saw us unmasked, it was because there were no other patients in the facility. And just to show you how many patients Dr. Y does, for the day I was patient number 9, for the week 31.
Wow.
I just can't get over the big medieval instruments and they're like wood chiseling on you and jerking around.
Felt nothing, just shaking.
Wow, and now you feel great.
I mean, look, I'm still dancing.
That's incredible. All right, thank you, Ken, for sharing that with us. All right.